Good evening, everyone, and welcome to our very first Digital Health Download episode for not just 2026, but ever. And I'm joined by my teammate, colleague, Lisa Bowes, Digital Health Support Officer. Between the two of us, we represent the Digital Health team at the Western New South Wales PHN. And this is the start of a monthly download on everything digital health that's been going on. And more importantly, because this is our first episode for the year, we'll reflect on a little bit of what happened towards the end of last year. So there's a little bit more content than I'd like in this one, but I'm going to try and keep it to a tidy 30 minutes so you can get back to your precious Tuesday night routine. But just quickly, some housekeeping. Questions are very, very much welcome. This is meant to be helpful at the end of the day. So if you do have some questions, throw it in the chat box. Lisa will do what she can to manage questions throughout the session, but I will reserve some time at the end to address any on the fly. Anything we can't answer tonight, we'll take it on notice and make sure we distribute answers in some follow-up FAQ documents. So everyone is on mute while I get through today's download, and we are recording this session so that those that couldn't make it tonight can pick up on the recording at a later date. But of course, I'd like to start tonight's meeting by acknowledging the traditional owners and custodians of the lands on which we all meet tonight. And I'm coming to you from Wiradjuri country in Orange, and pay respects to all First Nations peoples and acknowledge elders past, present and emerging, and recognise their continuing connection to the land, water, culture and community. And of course, extend that respect and warmly welcome all Aboriginal and Torres Strait Islander Australians who are present here tonight. So thank you for joining us. So the download series can be summed up in a very neat, I hope, 3 sections. First section, I'm going to cross off as much as I can in the latest news across the digital health landscape in Australia. And it's going to be broken down by all the usual suspects. Number 2 is a bit of a spotlight feature. So each month we're going to try and dive a little bit deeper into a certain topic. And for tonight, it's going to be about secure messaging and HealthLink in particular. And then reserve some time at the end for your Q&A. So without further ado, let's just get into some news items. I'm not going to talk too much about this one, but if you weren't paying attention last year, then here's a reminder that the Australian Digital Health Agency launched the national the Health Connect Australia, a national interoperability program. There's significant strategy, architecture and roadmap documentation. And funny enough, that's important context because later on, and then for the spotlight feature next month in April, we're going to go into a lot more detail about Provider Connect Australia and that context. But the initiative is all about standardising the data exchange and using modern frameworks to support a more connected care landscape, if you like, in terms of exchanging information. So that was announced and it's going to be around. You're going to hear about it a lot in the next 5 years plus because they've made it very clear that that roadmap has a 2030 plus kind of outline. So Provider Connect Australia. So the month of March and month of April, Lisa and I are going to be doing the rounds. So you expect a phone call from us if you're a practice manager or a practice owner. But have you registered yet? Because if you haven't, I highly encourage it. We will be using it, as I said, as a spotlight feature in March, but it is the key initiative from the Digital Health Agency's portfolio and the Health Connect Australia program. So it's a centralised platform for you to keep your business details up to date in a single centralised platform and make it very, very easy for you to share that information with business partners in one central place. So we'll be actively working with you to support you throughout the next couple of months. Just a little quick update on clinical information systems for the GP practices listening in. You should have been told about this by now, but of course, BP Premier and Halo Connect. I mean, look, BP's announcement regarding the New World Order and the role of Halo Connect in my travels has raised some questions around what is this now cloud operation that BP's undertaking. Effectively, Halo Connect is now how everything, especially third-party applications, will link in to BP. And so because the primary health network, we use PenCS as our product for data extraction from primary care, then you are required to set that up in Halo Connect. So if you haven't done that yet and you're a BP user and you're participating in PIPQI and sharing data with the PHN, you'll need to get onto this pretty soon. Now, there's some pretty clear instructions. Lisa's going to add to the chat a couple of links to the FAQ page at PenCS on how to configuration. There is an extensive step-by-step guide that we can also provide. So please reach out either to myself, Lisa, or the practice development team, and we can certainly support you. But it's very important as you follow the step-by-step instructions for setting up PenCS via Halo Connect, that you get that site ID that BP gives you, and you email that through to PenCS support. You have to email that through to them so they can record it on their end. My health record, goodness me. It's been really our focus for the last 3-4 months doing the rounds. And if you haven't heard by now, Lisa and I did a webinar on this on the 17th of February. The recording's there for all to see. But the biggest reform is the sharing by default. I won't go into too much detail because there's a dedicated webinar, plenty of resources out there, but shouldn't surprise you then that as of this Thursday, the 5th of March, My Health Record will be undertaking a bit of an upgrade in the system, and that's to allow for the 7-day delay to be removed for the X-ray. So this is the extension. We went through this update in October for pathology, and now they're delivering on the promise so that X-ray reports for limbs, arms and legs, removing that 7-day delay, will function as of the 5th of March. All right, I just want to throw this in because we haven't done a lot to support this from a messaging point of view, but just a reminder, anyone from the far west listening in on this, just a reminder that especially if you're a new GP to the area, this wouldn't come across your radar unless it would have been promoted either via connections within New South Wales Health or your clinical team members in practice. But just a reminder that the co-located GP clinic program, as far as I understand, is still operating. So if you are with a practice in the far west, you're new to the region, looking after patients, then technically check with your practice manager, but you should already be connected at an organisation level. It's just a matter of registering you as a clinical professional with your HPAI to gain access to HealthyNet via web portal and via your Proda authentication credentials. But there's an extensive step-by-step guide on how to use HealthyNet. You have to be added to the agreement. So there's a bit of admin, but more importantly, this is about informed patient consent. So the patient has to consent first within the hospital, that be recorded within the EMR to then flow through to be able to allow you to log in and see those patients' records sitting within HealthyNet over at the hospital. So if you're delivering care to patients as a general practitioner in the far west, this is seriously worth looking at. If you've got any specific questions or interest, you're more than welcome to reach out to us and we can point you in the right direction. Now, AI, look, this certainly deserves a spotlight or two on its own, but I just thought I would mention a couple of things. This sort of passed by very briefly last year. Look, there is a national AI plan and technology governance roadmap is sort of being indicated here with the idea of creating some kind of goalpost. But it's industry agnostic, but it is going to highlight the health sector in particular. But one thing I just want to reference here is it did prompt me to think about, and I was very fortunate, Lisa and I were very fortunate to go and visit a couple of practices throughout January, February, and we came across a couple of practices who are doing some amazing stuff in embracing AI, but doing it properly, and that is starting with an AI adoption and use policy. So before rolling it out amongst users, whether it be clinical use or administrative support, first of all, thinking about what's our policy, how are we going to advocate best use of AI, and when are we not going to use it? Setting up those frameworks are critical before you jump into the deep end. And it had me thinking about, well, can the PHN offer some guidance here? So I'm currently looking at developing perhaps a bit of a template that we can share with you. If you think that's a great idea, you could benefit from that, please let me know in the chat section, or reach out to us separately. But if there's a growing demand for something to guide you in that space, it is certainly something that I believe that we can support you on. All right, telehealth. So comes in all shapes and guises and sizes, but most of you will be across this. Again, this is old news from November last year, but new virtual care incentives and rules, especially regarding My Medicare in particular, were designed to modernise remote care delivery. So software vendors such as your BP, MD, etc., have all updated their systems in response. So it's not really new news. But on the other news front, you probably heard a lot about Eucalyptus Health and other brands offering telehealth capabilities. It shouldn't go without saying, speaking of AI, that a lot of them are looking to integrate AI tools into their service offerings. Again, using blended AI-enabled care models in this sort of space is, I would argue, quite an advanced level of digital health knowledge. So tread carefully, do your research, but certainly, and use your mature clinical teams to test and measure in these environments. And by all means, share your experience with colleagues. As some of you may know, the PHN still administers the Health Direct video call platform, which we have done since 2020 and the arrival of COVID, and it's still available. If you want to deliver a video call platform in a safe and conformant fashion and you're not using it, reach out. You can get a free account. We can set you up in 30 minutes and get you up and running. But there are some updates. The platform's always improving and updating things. And if you haven't utilized it, please look into it. And more importantly, it uses an app environment where you can plug certain additional features in. And of course, virtual form application is now available. So this is the bulk billing consent form. So all this stuff is enabled within the platform, making it quite streamlined and easy for your consultation workflows. So that informed financial consent is an example of that additional form that's available for configuration. And patient consult summaries were rolled out from December as well. So look, there's a lot going on in that space. I could talk for quite some time about this, but just know that it's meant to enhance that clinical experience in a virtual environment. All right, medicine safety. So, well, under the theme of medicine safety, I mean, everything from safe scripts to e-prescribing and the like. I want to just reflect and mention to you all, if you hadn't heard, Lisa and I embarked on a in-depth qualitative study in partnership with the team at Warren, which is Western New South Wales Research Network, Health Network, and we interviewed some GPs last year, and the results really weren't that surprising, with only 11% of GPs reported using Active Script List or My Script List or having some kind of knowledge. And so with those findings, Lisa and I are going to be launching in May, June this year, quite a large campaign to focus on the benefits and use cases for ASL and MySL. SafeScript New South Wales, big fan of this, and naturally they reach out to all the PHNs to help promote. If you haven't subscribed to the pharmaceutical services for news and alerts, feel free to do so. There's been some alerts. They constantly update their landing page. There's some alerts for pharmacists regarding forged prescriptions, which are continuing to circulate, so be mindful of that. And if you're a prescriber, you haven't used the approval management functionality, please check it out. It really simplifies and speeds up the prescribing of S8s and approvals. So if you haven't set up an account with SafeScript, of course, please do so and try it out. Okay, so you have to apply for approvals, and there's a link to a page for that as well. All right, drum roll, time for the spotlight for March. And as I said, I'm going to be talking about secure messaging. It's under the banner of secure messaging. And in particular, I'm going to talk about some new news on this front, in particular, eReferrals for New South Wales Health. But of course, why do in the world of digital health and maturity within digital health, why is secure messaging always considered the best option? Well, because it's about risk management, risk mitigation. And this is the basic pyramid And this comes directly from the RACGP when it comes to using email in general practice. And at the end of the day, secure messaging offers little to no risk in terms of keeping that patient information secure and safe in transit when you're using referral services. So that's why. But the new news really for March is regarding the statewide referral criteria for New South Wales Health outpatient services. A couple of things here. Going through a phase 2 update and improvement, both phase 2A and phase 2B. So phase 2A is really diving into diabetes, endocrinology, general pediatrics, maternity, general gynecology, oncology, and menopause. So this is planned at the moment, and again, use these timelines as a bit loose. But my advice is, we got the link there. Lisa put it in the chat, but pay attention to the SRC website, because that's where the updates will be made live. We will do our best as a PHN to echo that and feature in all our newsletters and communications as it drops. But phase 2B draft for cardiology, nephrology, and respiratory and sleep medicine is now available for consultation until the 6th of March. So there's not much of a window there, but of course, wheels are in motion of a continuous improvement in this space. Now, more importantly, this is about standardizing the referral guidelines, right? And expanding it to all these services. And so naturally, it needs to be reflected when you're referring a patient to the service. The expectation is when you're sending that patient referral information, the expectation is you meet the referral criteria that's been outlined. Now, in order to support general practices in that, there's going to be, your preference is, if you're going into Dubbo and Broken Hill Hospital, the primary source, of course, is going to be the existing HealthLink smart forms. But other base hospitals, it's not as easy as that. But where applicable, remember, there's health pathways. Please always have if health pathways in your web browser is not bookmarked and as a favorite, I suggest you do so, and refer to HealthLink as well. But the PHN, we, Lisa and I, are certainly going to do our best to support you by producing some templates where the provision of additional reports or images and the like, if that's not required as part of the referral criteria, and it can work as an RTF file template for you to load into BP or MD, then our plan is to sort of optimize them and produce them for you and make them available through health pathways. I think we might even have Ashley Wybrow with us tonight. So I'll put her email address up there, and of course the contact email address for Ministry of Health outpatients. If you do have any feedback or questions or the like, please reach out to the team there. They'll be more than happy to speak with you. Now, just back to the HealthLink smart forms. And again, a lot of the focus for my team last year was really about getting a bit of an uplift in the use of GPs to use HealthLink smart forms for referring the Dubbo into Broken Hill. But there has been some improvements from October last year with expanded social history fields, improved medication display details and that kind of in the forms and the generic forms in themselves. Obviously, New South Wales Health are constantly reviewing and improving the forms. And you're highly encouraged to feedback through the right channels, questions regarding, or if there are any usability bugs or errors, please pass them through and the team can optimize with HealthLink. But just a quick update on some of the other base hospitals. So Orange, Bathurst and the like. The team at New South Wales Health and HealthLink are still trying to do their best to get smart forms up and running for the services in Orange and or Bathurst at some point soon. No promise of a go live date, but it's still on the cards. Okay, so they haven't completely forgot about it, but the focus now between October and now has really to transition away from Argus. As you all know, Argus was removed from the landscape, and New South Wales Health recognised that they needed to replace one secure messaging system with another, and so they've rapidly moved to HealthLink EDIs for a lot of those services, and I'll communicate them in a second. But check for all these other hospitals, check the SRC and refer to Health Pathways. As I said, we'll try and make sure an RTF letter template is available for you to program into your clinical information system using the HL7 send feature within your software. Just a quick snapshot, Bathurst, Orange Hospital. Here, the latest information that I received late last year in terms of the services, and pay attention to the HealthLink EDIs in the far column there. Of course, if you can't use secure messaging in bundling up additional attachments, and your only option is the email, remember, always try and use a secure encrypted email, but they're the email addresses. So I think the focus should be on optimizing and updating your address books to reflect this, okay? And there's Mudgee, got the 2 there at the moment. All right, so we'll constantly update these and share these with you as they get updated. And a reminder for the clinicians in the room, get used to this, right? So when you're in, I think this is BP example, but use HealthLink to your full advantage. We've got down the bottom in the grey, that's your link to New South Wales Health Engaged Outpatient Services for Dubbo, Broken Hill, and other hospitals as they come online will be found there in the Western and Far Western New South Wales text link. Don't forget private specialists. There's your specialists and referral. That's the red logo at the top. Yes, that's a link, believe it or not. And that will open up another portal which you can find specialists, private specialists and allied health professionals who are listed and will accept electronic referral smart forms as well. They're generic forms, but highly recommend that as well. And of course, at the top is your HL7 send letter writer. You've got that at your disposal to try and use secure messaging where possible off the get-go. That brings me to an end on the spotlight, and now I'm going to move to, just very quickly before we get into the Q&A, just a reminder, continuous improvement, education and training is what it's all about in digital health. You're never a pro is the tagline. You need to work at it, and it's forever changing. So invest in yourself, invest in the team. Put digital health on your CPD consideration list. I'm going to constantly advocate for this. People often don't consider digital health as important or part of the mix. But I'm here to tell you there's plenty of ideas where digital health can play a role. So a couple of considerations down there: implementing or reviewing secure messaging, telehealth, e-prescribing policy and practices, AI policy, okay? Completing an online e-learning digital health course, conducting a clinical audit using PenCS, CIS, and the like. Measuring outcomes following a digital intervention, recalls, prompt, decision support, etc. It's endless, okay? So please think about how you could bring your efforts to uplift digital capabilities, improve your maturity as a practice by investing in some of these programs. Now, of course, the Australian Digital Health Agency has plenty of free online training. Lisa will make these links available in the chat, but there's heaps of e-learning modules. You can do this at your own pace. And in fact, on this note, I don't know if you noticed in some of the industry media this week, actually, the Australian Digital Health Agency announced that they're going to start embedding digital health foundations, and they're providing a toolkit to universities so that medical degrees can start addressing digital health training in university during medical degree, which I think is well overdue. So it's certainly exciting to see. And quick plug. So I also have a podcast program about digital health literacy, and tune in. I published it the other day. Shouldn't surprise you all, but that episode is a deep dive interview with Kieran Maguire, who's a product director for Provider Connect Australia. And so we talk at great length about PCA, its benefits, its future outlook, and its challenges and objectives. So tune in for that, for a real deep dive on what PCA is all about. And the next podcast to go live in May will, of course, be about Active Script List. And for that, I had a lot of fun interviewing a GP, a patient, and a pharmacist all together in the wonderful town of Forbes. So tune in for that one when that launches as well. So a real quick summary slide. If you had to do some stuff in March and April that reflects some of the stuff that we're talking about, here are 3 things that I would recommend you probably look at doing. So inform your teams about share by default reforms for My Health Record, and review existing recall and reminder processes if required, okay? Provider Connect Australia. So again, this is for your administration teams, your practice managers and owners in particular. Explore it, look into it, speak to us, or we can guide you, and it won't take up a lot of your time. And of course, secure messaging. Clean up your address book. I mean, your address book should be on the cards as an ongoing activity anyway. Optimize templates. Reach out to us and the New South Wales Health outpatients team to request the best way to refer patients into the system. And this now moves us to a bit of a Q&A. So I open the field. I'll stop sharing my slides and hopefully we've got some questions, Lise. If not,
no, unfortunately we don't at this stage.
Have I answered them all, have I?
Maybe you have.
Oh, there's got one question.
Oh, sorry, take that, Ashley.
And we got Ashley. Okay, hang on, Ash. We got to remove you from allow mic. Hang on. Okay, you should be able to talk, Ash. I think if you take yourself off mute.
Okay. Can you hear me?
We can hear you.
Perfect. So I was probably just going to let everyone know that Health Pathways, we have also recently updated with our referral pathways. So in anticipation of the statewide referral criteria going out, we have just recently updated all of the contact details, the fax details, and the team email addresses for all of our action clinics. So when you are reviewing your address books, potentially just reflect on the Health Pathways for the most up-to-date information.
Thank you very much for absolutely. So, which is why I recommend bookmarking Health Pathways. It should be a regular feature for administration. I was referring to, clinicians to bookmark it, but I mean the entire team. Okay, so admin team as well, practice managers, support staff. If you're responsible for keeping that address book up to date for the clinicians in house, then tuning into Health Pathways, getting an account, registering for an account and tuning in to get the latest information on that would be really helpful. So thanks, Ash. Is there anything else, Ash, you wanted to add regarding, did I cover everything?
Probably one thing that I'll add into ERMS. So we have just been advised this week that it will be rolled out this year in both Orange and Bathurst. So probably more looking at the second half of the year. So that is definitely coming.
You're talking about the smart forms. You're talking about the smart forms.
So sending through electronic referrals. And then just in terms of the initial rollout with statewide referral criteria, obviously Orange and Bathurst is still on the paper-based and manual forms. So I know we've spoken about creating those templates, and we will do once the statewide referral criteria has been finalised. So we're just waiting for that to come out. But once again, as soon as they're completed, we are hoping to have those templates up on the Health Pathways as well, which will hopefully help navigate the inclusions that are required to make an acceptable referral. But my contact details are there, so if anyone's got any questions, I'm more than happy to answer those.
Yeah, no, thank you so much, Ash. Really appreciate you coming on tonight. Sorry it was late notice ringing, but really appreciate it. It certainly helps advocate. And Lisa and I, this Friday, speaking of templates, we're undertaking some advanced training to be able to take some of these templates and optimize them for best practice in medical director. So hopefully Lisa and I will fast track when available. Some of these to be made available in Health Pathways once we get them optimized, ready for upload into practice software. Okay. Anything else? Any other questions? A lot of links there, Lise. Thanks.
That's okay.
Okay. Well, if there's no more questions, there's very light attendance tonight. So what I will say before I end tonight's meeting, if you're catching up on this as a recording later and you do have some questions, you can definitely email them through to the digital health team. So Lise, can you just quickly pop in the email address for our inbox? And that's open to everyone. If you have a question, don't be shy. Hopefully most of you will have my email address or Lisa's, but you can email to our joint inbox as a team, and we constantly look at that regularly to address any any questions you may have. If there's a specific project or a QA activity you need support on in a digital health sense, we're here for you. And on that note, I guess I can bring the meeting to a close. So thank you all for those who could join us tonight, and we'll see you next month for the download in April. Until then, ciao for now.